Whether it's in our immediate communities, across our country, or throughout society at large, design researchers can contribute both increased intentionality and diligence in catching the blind spots that often disregard the people who are most marginalized, forgotten, targeted, ignored, and disenfranchised. For without this attention, we risk widening and deepening the very gaps of inequity that we are striving to resolve. And as we calibrate towards future dimensions of normalcy, eliminating these gaps become all the more crucial. As we investigate the potential impact of design research, I think the following roles can help prevent this outcome, as well as help us imagine more ethical policymaking towards the future. Design research can help us generate more robust primary data, fill gaps in secondary data, and identify bias. For if people are not counted, can we truly design for justice? For instance, we know that in several countries across the globe, people who die at home are not counted as quickly or consistently as people who succumb to their COVID symptoms in the hospital. As well, we have learned that people of color in several states across the U.S. are dying at higher rates from COVID-19 in communities where they are actually the minority. But because racial analyses of cases are only recently being conducted, we know that there is more comprehensive research that can be created in this regard. Design research can serve this role and help in the redesign of community response systems, the identification of bias incidents and communication gaps, and open more paths towards systems level change for those who need it most. Secondly, design research can help us identify and expose behavioral patterns of this new normal and identify barriers like access to vaccines, to testing, to other resources that people may need. Three audiences that I think about most in this regard first includes domestic abuse victims, those who suffer physical, emotional, and financial abuse from within their home and thus may not be able to easily access the care, support, and resources that they need during the crisis. Secondly, I think of the dilemma of Black men and the new requirements of face masks in public. Because Black men are already the most targeted cultural group by both police and pedestrian vigilantes, navigating these dilemmas may expose increased hardship in adapting to new social norms. And finally, I think of those who are visually impaired or may embody other sensory or cognitive impairments. Design research methods can help us identify these changes in behavior and aid in the ways we might design and plan amenities and services in our cities moving forward. A third role that design research can play is as a synthesizer. In an age of gross misinformation, design research can help the public better extract, represent, visualize, and understand data sets in the daily onslaught of updates and changes and information that we receive. Such processing can help our policymakers make stronger and more equitable decisions. This is especially true as several governors fight the battles of economic recession and public health crisis in the midst of civic confusion and inconsistencies across states. This also leads to a fourth role that design research can serve for helping to clarify and forecast how policy decisions and changes will impact populations of people with the least social agency, such as those who are incarcerated, those who are homeless, and those who are undocumented. And finally, design researchers can serve in the evaluation of our national response at large. Formative evaluation can be used to monitor and strengthen processes of coronavirus testing, hospital operations and systems, as well as vaccine development in order to design better processes, equipment, and tools. Summative evaluation of variables such as recovery to death ratios can help us know whether our desired goals of flattening the curve are being achieved with justice and equity as an outcome. Each of these 5 roles can help us reimagine power dynamics and uncover new ways of designing ethical policies, places, and practices that meet the urgency of now. But it starts by where we choose to place our attention.